people who suffer from schizophrenia and bipolar and serious depression are likely to die up to 25 years younger than the general population due to the fact that their physical health suffers. So the project has been about giving patients who suffer from serious mental illness a better quality physical health care. We've developed a system within IT, so it's a data entry template that will put together a physical health check to guide clinicians through a systematic standardised approach to care. So if a patient was to go to a primary care GP practice and sit down in front of a practice nurse, the template would guide them through what would prevent this patient from dying younger. Same again in secondary care. We've launched 5 clinics across the community mental health teams. Same thing, mirrored template, and the outcome data can be measured behind the data entry template. So therefore, we're going to look at how we can prevent those early deaths by monitoring them closer. I've seen so many differences made by just going that extra mile. So I might see a patient and think, well, actually, while I'm here, I'll run a blood test, take a blood pressure. And the difference in a patient when you take an actual real interest in their physical health, I've seen the difference in patients and the recovery rate much quicker. There's definite improvements. Patients will live longer. It will take a few years, but patients will definitely live longer as a result. And not just live longer, but live healthier, more importantly.
The Carer Centre tender was truly a fabulous project. The procurement was innovative in a number of ways, mainly because it included informal carers in the procurement process far more than any other procurement that I believe has been in local NHS commissioning. Carers from the outset were included in consultation. They were included in the designing of the procurement documentation, including the specification. They were also included in the evaluation, and overall they had more say than that of professionals within the process, so in effect they chose the provider they wanted to see for their carer support services. I think having carers throughout the process has benefited the entire process from both the patient and the commissioner's perspective for a number of reasons. I think mainly the reason is that they were included from start to finish, so that we identified and articulated an appropriate vision for the service. We were then able to identify the appropriate provider, and then subsequently to help inform the implementation process meant that not only had we picked the right provider, we'd launched the provider to deliver the services that were appropriate to meet need. I think it's really important to have innovation in the NHS because I think it's innovation that strives for improvement, enhanced quality and improved outcomes for patients and carers. And in particular in the procurement process, I think the innovation in terms of carers being involved in the decision making means that we value carers and that we identify that they've got support needs in their own right and that we need to meet those needs.
Leadership is about making sure that we provide an excellent service, and leaders are there to give the direction to make sure that patients get what they deserve. We've set up a service to help stroke patients get home earlier than usual, and we've set this service up after working very hard at it to get the staffing and to make sure the service delivery was safe. We had to do it with very little money, and so we had to think laterally because the evidence shows that it's much better for stroke patients to have their rehabilitation at home. And so basically it's about delivering patients rehabilitation in their own home. So rather than them spending extended period of time in hospital, they get to go home, which is what every patient who's had a stroke likes to do because they've had this devastating thing that has happened to them and they don't want to be sitting in hospital. And yet there's a lot of work that they need to do to get back to being as independent as they can be. So the team consists of therapists and rehabilitation assistants who are trained in delivering stroke rehabilitation to patients. So they could work anywhere, they could work in the hospital or in a patient's home, but they happen to work in a team that works in the patient's home, delivering the rehabilitation that they've been trained for. So they have stroke-specific skills that they've been trained in to deliver those. Benefits for the NHS hospital is that we get the patients out of hospital sooner. This means that beds are available for the acutely ill patients, because stroke patients, once they're over their acute medical period, don't have as many medical needs and therefore they can go home. So it means that the beds are made available for those patients that need it.